Got diabetes? Controlling your blood sugar isn't just about taking meds. It's about knowing how your body reacts and making smart choices in 3 key areas: medication, exercise, and food. But that's not all. Let's break it down together. All right, let's start with the basics. Part 1, know your targets. Here are the blood sugar numbers most people aim for. Fasting glucose, between 80 and 130 milligrams per deciliter. 2-hour post-meal glucose, under 180 milligrams per deciliter. Hemoglobin, A1C, under 7%, unless your doctor tells you otherwise. Now, these targets can shift depending on how long you've had diabetes, your age, or other health issues. So make sure to check with your doctor regularly. And if you're carrying a bit of extra weight, losing just 5 to 10% can make a huge difference. Your doctor can help you figure out a realistic goal. Part 2, medication. If you're on medication or insulin, take it the way your doctor says. No skipping, no guessing. We'll cover more about medications, like insulin, metformin, and other options, in a separate video focused just on that. Stay tuned. And if you're having side effects, or the meds are too expensive, say something. There are always options. Remember, meds are just one part of the puzzle. They work best when paired with healthy habits. Part 3, exercise. Let's talk about moving your body, because exercise can really help your blood sugar. And no, you don't have to run marathons or hit the gym every day. There are 2 main types of movement you want to think about. 1, aerobic or cardio exercise. This includes walking, biking, swimming, anything that gets your heart rate up. It helps lower your blood sugar pretty quickly. Best time? Try it about 30 to 60 minutes after meals, when your blood sugar is likely to spike. Start small. Even 10-minute walks after eating can make a difference. Aim for a total of 150 minutes a week. 2, strength training. This is about building muscle, and more muscle means better glucose use. You don't need fancy equipment. Bodyweight exercises or light weights at home are enough. Try to do it 2 to 3 times a week, and avoid doing it right before bed. Now, if you're trying to lose weight, combining cardio and strength training is the way to go. They work better together. And remember, you don't have to do it all at once. The key is to start moving and stay consistent. Part 4, eating smart. Let's talk food, because what you eat, how much you eat, and when you eat all play a huge role in blood sugar control. 1, carbohydrates. Choose carbohydrates that are high in fiber, like whole grains, beans, vegetables, and fruits with the skin on. Go for carbohydrates with a low glycemic index, like oats, barley, lentils, and sweet potatoes. These raise your blood sugar more slowly and steadily. Avoid refined carbohydrates like white bread, pastries, and sugary cereals. Watch your portion sizes, especially for rice, bread, and pasta, even if they're whole grain. 2, protein. Choose lean proteins. That means foods high in protein but low in fat, like chicken breast, fish, tofu, eggs, or beans. 3, fats. Don't forget about healthy fats. Foods like avocados, nuts, seeds, and olive oil help slow digestion and keep blood sugar stable, especially when combined with carbohydrates. 4, vegetables. Load up on non-starchy vegetables. These don't spike your blood sugar. Think spinach, broccoli, peppers, cucumbers, and mushrooms. 5, other tips. Eat meals at regular times to avoid big glucose swings. Trying to lose weight? Focus on small, sustainable changes, like swapping fried foods for grilled or soda for water. Reducing empty calories helps your body respond better to insulin. And remember, you don't have to be perfect. Just a few smart food choices every day can lead to big improvements over time. Part 5, self-monitoring. When and why checking your blood sugar. Great, but timing matters. Here's when to check. Before meals, shows your baseline. 2 hours after eating, shows how food affects you. Before bed, checks overnight trends. Before and after workouts, especially if you use insulin. Anytime you feel off, shaky, sweaty, dizzy. Now, not everyone needs to check at all of these times. For most people, checking before meals and at least one post-meal reading per day is a good start. But if your blood sugar isn't well controlled, or your doctor wants closer monitoring, you may need to check after every meal, and sometimes at bedtime too. Why all these times? Because your numbers change depending on what you eat, how you sleep, how stressed you are, even what meds you're on. Look for patterns, not just numbers. That's where the real insight comes from. Your doctor can help you figure out when and how often to check. Part 6. Other stuff that affects blood sugar. There's more to this than food, exercise, and meds. Your blood sugar can also go up because of stress. Your liver dumps sugar into your blood. Lack of sleep messes with your hormones. Sickness or infections. Hormonal changes, like periods or menopause. Other medications, even some cold meds, can affect your glucose. So if your readings suddenly seem off, zoom out. Something else might be going on. Here's the truth. Managing diabetes isn't about being perfect. It's about showing up every day. Some days will be great, others, not so much. That's okay. Stick to the basics. Take your meds, move your body, eat smart, check your sugar watch for trends. Be kind to yourself, talk to your care team, ask questions. You're not alone. You've got this. Manage your health wisely and stay updated with real doctor tips. Doc4U trusted medical advice from a real doctor.